Don't wait until it's too late. 13 shocking signs your blood pressure is high. Hello, my friends. Today, we're going to talk about a very important but often overlooked issue: high blood pressure, or the silent killer. Over 1.28 billion people worldwide are living with it, and nearly half of them don't even know they have it. The scary part is that high blood pressure often doesn't show any obvious symptoms, but your body is constantly giving you signals. Have you noticed any of them? Today, I'm going to break down 13 warning signs of high blood pressure that you should never ignore. These signs could save your life. Ready? Let's dive in, and don't forget to hit that like button and subscribe for more life-saving health tips. 1. Headaches. Imagine you've been sitting at work all day and suddenly you get a terrible headache. That's what many people, like James, experience when their blood pressure is high. These headaches aren't just a result of stress or fatigue. They can be a warning sign of high blood pressure. When blood pressure spikes, the pressure in your skull increases, causing excruciating pain. That's why when James told me that his headaches were getting worse, I immediately checked his blood pressure and found that it was dangerously high. A recent study in the Journal of Headache and Pain, 2024, also showed that people with high diastolic blood pressure are at risk of migraines. So if you have frequent headaches and can't figure out why, remember to check your blood pressure, because early detection can help you prevent more serious problems later. 2. Dizziness or lightheadedness. We have another patient, Linda, a lovely lady in her 70s, who started to notice her vision getting blurrier over time. She thought it was just age, but it could actually be a sign of chronic high blood pressure. High blood pressure can damage the blood vessels in the eyes, leading to a condition called hypertensive retinopathy. A study from the American Heart Association found that when high blood pressure causes the arteries in the retina to narrow and harden, the eyes don't get enough blood and you experience blurred vision. Linda was eventually diagnosed with high blood pressure during a routine checkup, and her doctor immediately encouraged her to make lifestyle changes and start treatment. If you're experiencing blurred or double vision, don't ignore it. It could be related to high blood pressure. 4. Shortness of breath. Let's go back to James. After getting his blood pressure checked, he also said that he started to feel short of breath when climbing stairs or even walking a short distance. He thought it was due to aging, but in fact, this could be a sign of high blood pressure. When your blood pressure is too high, it makes your heart work harder. This can lead to pulmonary edema, a condition where fluid builds up in your lungs, making it difficult to breathe. A study published in the Journal of the American Heart Association, 2023, found that pulmonary edema often occurs when high blood pressure is not controlled. If you feel short of breath for no apparent reason, especially when accompanied by other symptoms such as dizziness or chest pain, see your doctor to get your blood pressure checked. 5. Chest pain or discomfort. Chest pain is alarming, and it can be linked to high blood pressure. When blood pressure is high, it causes the heart to work harder. This can lead to chest pain or angina, which happens when the heart muscle isn't getting enough oxygen. A study in Pain Reports 2019 found that people with high blood pressure reported more intense chest pain during heart attacks. If you feel chest discomfort, especially with shortness of breath, dizziness, or nausea, it's essential to seek immediate medical attention. 6. Nosebleeds. Nosebleeds might seem harmless, but if they happen often, they could be a sign of high blood pressure. High blood pressure can make the blood vessels in your nose more fragile, increasing the risk of them rupturing. A study published in JAMA Otolaryngology 2020 found that people with hypertension are more likely to experience frequent and severe nosebleeds. While not all nosebleeds are caused by high blood pressure, if you notice frequent nosebleeds, it's worth discussing with your doctor. 7. Fatigue or confusion. If you've been feeling unusually tired or confused, even after a good night's sleep, it could be a sign of high blood pressure. High blood pressure can damage your heart and kidneys, leading to tiredness. When the heart struggles to pump blood efficiently, your body doesn't get enough oxygen, leaving you exhausted. A study from Healthline suggests that fatigue can also be a symptom of heart or kidney damage caused by high blood pressure. Confusion is another red flag. When blood pressure gets dangerously high, it can cause swelling in the brain, leading to confusion and even memory loss. If you've been feeling tired or foggy, get your blood pressure checked immediately.
8. Nausea or vomiting. Nausea or vomiting without an obvious cause can be linked to high blood pressure. When blood pressure rises to dangerous levels, it can activate the brain's vomiting center, causing you to feel nauseous. A study published in Journal of Clinical Medicine 2023 showed that people with hypertensive crises often report nausea or vomiting as a symptom. If you experience these symptoms alongside a headache or dizziness, don't wait for it to worsen. Seek medical help. 9. Heart palpitations. Have you ever felt like your heart is racing, fluttering, or pounding out of nowhere? That sensation is known as heart palpitations, and it can be caused by high blood pressure. When blood pressure is elevated, it can cause changes in the heart structure like left ventricular hypertrophy, which can disrupt the normal electrical signals in the heart. This can lead to irregular heartbeats, also known as arrhythmias. A study in the Journal of the American Heart Association 2020 found that effectively controlling blood pressure can significantly reduce the incidence of heart arrhythmias. If you feel like your heart is beating irregularly, don't ignore it. It's time to check your blood pressure. 10. Tinnitus, ringing in ears. Another symptom that is less commonly associated with high blood pressure is tinnitus. I remember a patient, Robert, who came to see me because he had a constant ringing in his ears. At first, he thought it was due to his age, but when I asked about his blood pressure, I found out it was very high. It turns out that high blood pressure can put stress on the blood vessels in the ear, leading to the feeling of tinnitus. A study in Frontiers in Neurology 2022 found that people with high blood pressure have a higher rate of tinnitus than people with normal blood pressure. If you experience this, especially when starting blood pressure medication, consult your doctor immediately. Controlling your blood pressure can help reduce the symptoms of tinnitus. 11. Tremors or muscle shaking. High blood pressure can also lead to tremors or muscle shaking. When blood pressure rises, it activates the body's fight or flight system, releasing adrenaline and causing muscles to shake involuntarily. A study in Journal of Hypertension 2016 found that people who experience noticeable hand tremors may be at a higher risk of developing hypertension. If you notice your hands shaking regularly, don't wait. Get your blood pressure checked and consult a healthcare professional. 12. Facial flushing. Have you noticed your face turning red after drinking alcohol? This may not just be a reaction to the alcohol itself. For some, it's a sign of rising blood pressure. Certain genetic traits slow down the breakdown of alcohol in the body, causing blood vessels in the face to dilate, which leads to facial flushing. A study in Journal of Clinical Hypertension 2022 found that people who experience facial flushing after drinking have a higher risk of developing high blood pressure. If you're noticing more frequent flushing, it might be time to monitor your blood pressure. 13. Numbness or weakness in limbs. One very serious symptom that I want to share is paralysis or muscle weakness, especially when your blood pressure suddenly increases. I once had a patient named Mr. Thomas, a 68-year-old man who came to the clinic with paralysis on one side of his body. After doing tests, we found that his blood pressure had reached dangerous levels, causing a stroke. This is a sign that no one should ignore. High blood pressure can damage blood vessels in the brain, causing a stroke, causing paralysis or muscle weakness, especially on one side of the body. The American Heart Association recommends that if you have this symptom, you go to a medical facility immediately for emergency treatment. Stroke is a medical emergency, and controlling your blood pressure can help you avoid this dangerous situation. Conclusion. So there you have it, 13 signs of high blood pressure you should never ignore. Recognizing these symptoms early can help you manage your blood pressure and avoid serious complications in the future. Regular checkups and being mindful of your body's signals can make a huge difference in your health. If this video was helpful, please leave a helpful comment below, like the video, and subscribe for more life-saving health tips. Thank you for watching, and remember, your health is in your hands.